We are going to talk about postpartum pelvic floor neuropathy, um, more specifically the pudendal neuropathy. Pudendal nerve is a nerve that goes from your lower back and practically supplies the whole external genital and vaginal region. So it comes from the S1, S2, S3, mostly S3 nerve, and then as it goes through an area close to the sit bone called Alcock's canal, and then gives branches to the anus, to the perineum, to the vulva, to the clitoris, to the urethra. So it's virtually supplies your whole pelvis. And that explains with injury, you can have very varied symptoms going from anal pain to urethral pain to lack of sensation to burning, feeling like it's on fire, or all of the above, and diagnosis can be very confusing. Also, the fecal incontinence and leakage of urine are a result of injury to this nerve as well, as inability to being able to have a bowel movement or void. In normal patients, this pudendal nerve injury can be a result of surgery or can be the result of injury to the Alcock's canal, which means that if you're a gymnast, soccer player, etc., you fall on your sit bone and the nerve is going through the Alcock's canal, it sort of gets crushed there, inflamed, causes severe gluteal pain, discomfort, and would make things very miserable. However, during childbirth, the nerve is vulnerable because of the childbirth itself. And as the baby is going through, the nerve gets stretched, especially if the second stage of labor is prolonged. Then the nerve stretching is even more pronounced. And injury to this nerve specifically can cause transient urinary incontinence and fecal incontinence. So what's the relationship between the levator ani muscle and the pudendal nerve itself? Well, if you look at the nerve distribution, as we discussed, and it's coming through and supplying your whole pelvic floor, the muscles are separating the nerves from the pelvic cavity. So the nerve sits outside of the muscles. And you can see the relationship here. However, as the baby is coming through, you can see that the nerves get stretched and get pulled with the delivery of the baby. And also you can see the muscles again that are inside, and as long as the muscles are intact, even though they're getting stretched, they're protecting the nerve to some degree. So what happens is that when these muscles are injured and you're not delivering a baby anymore, the pressure that is coming through the abdomen, when you don't have the muscle, it transmits to the nerve, and then that nerve, just like during childbirth, is going to feel the sensation of this pressure and translates it to pain and discomfort. So the nerves that are most frequently elongated and injured are the inferior rectal nerve, and we can see these that they stretch the most, but again you can have pain in any distribution. So Besides the normal pudendal stretching that can happen during vaginal delivery, the levator muscle has protective effect by shielding the pudendal nerve from the abdominal forces. Once the muscle is injured, pudendal neuropathy is common. Pudendal neuropathy symptoms can be elusive and difficult to diagnose. Perineal protection, a medication called Neurontin, and time are the mainstay of treatment. While in normal patients, the pain is due to entrapment in the Alcock's canal, and standing may make the symptom better. In postpartum patients, paradoxically, the pain worsens with the standing due to increased pressure. I hope this has been helpful to you. Thank you.